I'm delighted to be joined now by the chair of the organising committee here for the forum, who, as you all know, is Professor Loutan. Louis, thank you ever so much indeed for joining us today.
Thank you.
Now, Louis, a lot of people have made a big effort to get here today.
That's incredible. I mean, understanding the problem, I mean, all the European sky closed, etc. We have people who have taken their cars and driven all the way from England, from Belgium, from Germany. We even have our colleagues from Haiti who are going to participate actively to this forum. They've been able to make it to come here. You see people used to crises, and if you compare the crisis we are sharing now compared to what happened in Haiti, it's fantastic to see them here, and so we'll share their experience, expectations and needs together.
Now, Louis, 2 years in the making, what's so significant about the theme and how did you come up with it?
You see, the first time we did it was general global health overview. Second time we did it 2 years ago, it was more on strengthening health systems and the crisis around the global health workforce. And so we realized, and we're not the only one, I mean most people do realize the importance of having strong health services. When you think about all the global health initiative, etc., if you really want to have them reaching the people, those most in need, you need to have a basic health system in place. So we continue to build on that. Now, in between 2008 and now, there have been crises. Not only one crisis, but there are several ones. I mean, there's an oil crisis, an economic crisis, a food crisis, and the climate. I mean, we see a little bit of that with the volcano now, but it's a little part of it. And so we thought, well, strengthening health systems, talking about globalization, but it's not an even movement and an even process. We need to tackle also what happens when you have a crisis. It can be regional, can be local, but the illustration of the volcano now is that a local event becomes global. And so that's the point of, and I think this illustrates pretty much our point.
Now, Louis, one of the themes of this week is very much people coming together to share information. What do you hope that folks are going to get out of the forum when they leave Geneva?
You see, I think the more we think about the usefulness of this forum, the Geneva Health Forum, you have a lot of experts meeting. We don't want to do only that. You have a lot of, particularly in Geneva, you have the WHO World Health Assembly every year. So it's policymakers, it's Ministry of Health, big NGOs also, and the private sector. And we have realized more and more that very often there's a gap in between the policymakers, decision makers, and the practitioners, and those working in the field. And when we talk about it, when we look at it, there are lots of fantastic experience being done in the field, new initiative. But nobody knows about this. And very often people, practitioners working in the field or decision-making workers working in the field do not have the opportunity to share that. And so that's one of the things. Get policymakers and decision makers also together with people and bring people from the field to bring the experience back. Those who can cause change, I think, should be more and more listened to. And we try to do that. A lot in a conference like that is interaction, and we hope that new partnerships are being established, that people with one experience, I don't know, in Sri Lanka or in Africa or in Eastern Europe or in Europe, have a chance to share and get the lesson learned out of that and try to apply that or adapt that to their own conditions.
Louis, thank you very much indeed for joining us today on Global Health TV.
Thank you to you too for being here. We really appreciate it.